Hi, my name is Andrew Phillips. I'm the founder and editor-in-chief of EM Coach. And I'm going to go over this month's EP monthly edition of our question for you. Spoiler alert, if you have not read the question yet, please go ahead and take a look, answer it, and we're going to go into a few more details with this conversation right now. The spoiler here is that it's Ramsay-Hunt syndrome. It's basically a patient in this vignette who has CML, so you could expect some immunodeficiencies, and the patient is presenting with the facial droop and some pain in vesicles. And so what you want to be looking for with Ramsay-Hunt, it's this triad of the facial paralysis, some sort of rash, whether it be up in the kind of cheek, facial area, or over in the ear. Sometimes it can just present with ear pain, and then also so the pain, the rash, and the facial droop. Ramsay-Hunt syndrome is not terribly common. It's caused by varicella reactivating in the geniculate ganglion. Actually, when we talk about Ramsay-Hunt syndrome, a little side factoid next time you're playing Trivial Pursuit, there are two types of Ramsay-Hunt syndrome. The first one is a cerebellar degenerative process that is very rare and not something that is within the scope typically of emergency medicine. The second is the Ramsay-Hunt syndrome. When we say that colloquially, we're really referring to the type 2, and that's the syndrome that's coming from the varicella that's coming back. So the idea is that whenever you have someone with a facial droop, go ahead and do a good solid exam. Make sure there are no vesicles, whether on the face, on the inner part of the ear. You want to take the otoscope, look inside that canal, and ask a good detailed history of whether they have any pain there, because they can also simply be presenting with inner ear pain. They can be presenting with vertigo, or the vertigo patients often will describe simply something as not consistent with what we think of vertigo, but just the dizziness or an upset stomach, right? So any of those kind of descriptions, along with a single-sided and ipsilateral facial paralysis, be thinking about Ramsay-Hunt syndrome. Now, in this case, I do want to point out it's important to mention that this patient has CML and has some immune compromised problems. So with that, absolutely. Now, because in this case, we have the flank pain, potentially getting some sort of rash shortly here from the varicella reactivating, absolutely needs to be admitted and get IV acyclovir. That is not a dischargeable kind of thing when you have an immune-compromised patient with disseminated zoster. That is absolutely admit, get IV acyclovir. So that is Ramsay-Hunt type 2, actually, but Ramsay-Hunt syndrome, single-sided facial paralysis, pain, and vesicles in the ear and face. This is Andrew Phillips from EM Coach. Thanks for watching.